The 7-phase method to design, implement and evaluate a critical care pathway. Phase 1. Screening. The screening phase starts when the demand for a new care pathway is made or when the team feels there is a need to adapt an existing pathway. The objective of this phase is to determine whether a care pathway is the appropriate method to meet the demand. Care pathways are not the solution for every problem concerning the organisation of care processes. Sometimes, a simpler intervention, such as the development of a new information brochure or organising an additional training, can solve the problem. The screening phase can be positively evaluated if it can be explained in an objective manner whether starting up the project is a justified choice. The decision to start up a project should be judged on such factors as whether there is a need for the revision of the care process based on the current results, whether a care pathway is suitable to achieve the desired outcomes, and is the team willing to change. Phase 2. Project management. To develop, implement and evaluate a care pathway, a project structure has to be set up. The pathway must be clearly defined, both regarding the patient group, this means clearly specifying inclusion and exclusion criteria, and the time period, i.e. the start and end point. At this stage, drawing up a project charter or project contract should be considered. The team should be composed of representatives of the professional groups who have direct contact with the patient population within the agreed time frame. This project management phase can be evaluated positively if the boundaries of the care process for which the pathway is developed are clear. Furthermore, the members of the multidisciplinary team need to be aware of the why, the project approach, and the desired outcomes. At the end of this phase, the decision to carry out this project is reconfirmed. Phase 3, the diagnostic and objectification phase, is a very important phase of this 7-phase method. The goal of developing pathways is not to develop something new or perform a total redesign, but to understand the weaker parts of the organisation and standardise them where necessary and appropriate. The current organisation of the care process should be evaluated from 4 different perspectives: the vision of the patient and the family, the available evidence and legislation, the views of external partners, and the internal organisation and team. In order to achieve person-centred care, patients and their families must also be involved in the design of the care process. This can be done by organising interviews or focus groups, or by conducting surveys regarding patient satisfaction, expectations and preferences. This way, the organisation gets a picture of how the patient or family member passes through and experiences the care process. State-of-the-art care pathways should be based on the latest available international standards. Although evidence is not available for all activities in the pathway, certainly key interventions are to be supported by international standards, local protocols or clinical expertise. The same applies for the outcome indicators that need to be monitored. The current organisation of the care process also needs to be evaluated from the perspective of external partners in primary or secondary care. Finally, the current organisation of the care process should be analysed from within the own organisation and the own multidisciplinary team. After executing this method, one obtains a list of project and process goals, a first blueprint of how the key interventions of the care pathway can be sequenced, and a list of problems and unclear aspects that need to be further investigated. Phase 4. Development. In this phase, the pathway is developed based on the objective information and the predetermined objectives of the screening and the diagnostic and objectification phase. During this phase, the team will possibly have to redefine the patient group and the time frame based on knowledge obtained in the previous phase. During the development phase, the pathway gets not only designed, but also practically developed. Phase 5. Implementation. When the pathway is fully developed, the implementation phase can commence. The goal is to prepare for the use of the pathway in daily practice by informing all team members and to test the pathway for a predetermined period. Based on initial experiences, the pathway is adjusted where necessary. The core team evaluates the test phase based on feedback from team members and decides whether or not the pathway is put into service. If major problems or bottlenecks are noted, it may be necessary to collect additional information or to obtain the advice of other clinical disciplines or the management. The implementation phase can be evaluated positively if, based on the first experiences and after consultation within the core team, it was decided whether or not to use the pathway in daily practice. At the end of this phase, the pathway is implemented into daily practice, and the pathway document is used to guide the team in managing the care process for a specific patient. Phase 6. Evaluation. After the pathway has been implemented, it will be evaluated. In this phase, it will be investigated whether the bottlenecks in the organization of care, which were present before the implementation of the pathway, were eliminated. Phase 7. Continuous follow-up. If the results of the pathway were positive, the pathway continues to be used in daily practice. It is nevertheless important to continuously follow up its use and results. In other words, the pathway must be kept alive and adjusted where necessary. As pathways are clinical process innovations, the possible criticality point where the improvement slows down or decreases needs to be tracked.